It's a very exciting ASH for us in terms of multiple myeloma because of this new class of agents called bispecific T-cell engager antibodies. So basically, we've had antibodies in myeloma for many, many years, but these are a new class of antibodies that attach to two different targets. And we now have some newer targets as well that we've been exploring, and that's part of what the Monumental study is looking at, GPRC5D, which is a receptor on myeloma cells, and this is the first in class bispecific engaging that target. It's a phase 1 study that again is patients with relapsed refractory myeloma, so very advanced disease patients. And we looked at two things. One, we looked at an expanded cohort treated with a weekly dosing schedule. And then we also looked at a newer dosing schedule of patients treated every 2 weeks. And we'll be presenting sort of updated data of both of those. I think the things to really focus on are just the fact that these are patients who have advanced refractory disease with a median of 5 to 6 prior lines of therapy. And up to a quarter of them are actually penta-drug refractory. So again, a very challenging group of patients. Response rate was very encouraging, with up to 70% of patients responding. So again, in this advanced, heavily pretreated patient population, to get those kind of response rates, again, is very encouraging. And then what we saw in terms of side effects was very much in keeping with some of the earlier data that we presented. Cytokine release syndrome was probably the most common non-hematologic side effect. And that's again in keeping with this class of drugs, bispecific. When you engage T cells, you get cytokine release. Again, fortunately, this was very manageable. The schedule uses a sort of step-up dosing schedule, so small doses first to try and minimize severe cytokine release. And with that step-up dosing, again, we saw only one patient with a grade 3 cytokine release. So again, most patients had cytokine release, but it was mild and manageable. We saw some other sort of non-hematologic toxicities that were in keeping, again, with the target and this class of drugs, and specifically some nail bed toxicity. We also saw some skin-related disorders in about 75% of patients, again, mostly mild, tend to be skin exfoliation that was mild and self-limited. There's two kind of things in terms of next steps that certainly, obviously, longer follow-up for these patients who remain on study to really get a better understanding of how long do these drugs work. Secondly is in terms of then combination trials, and those are already ongoing as well. And in fact, at the same session that I'm speaking at, there will be a presentation of using this drug Talquetamab in combination with daratumumab, and so exploring it in combination settings, and ultimately also exploring it in earlier relapses.